Nurse anesthesia is the profession where we provide sedation, we provide anesthesia, and we provide pain relief to patients that are undergoing surgical procedures.
A common misconception is that CRNAs practice under the direct supervision of someone. In some settings that is true, but throughout the United States, CRNAs can practice independently in a variety of settings.
So that can be in a large medical center or even a doctor's office.
There's really so many positive aspects about our profession. Most people, their first question is, how much money do you make? There's no real exact answer for that, except for you get paid very well for what we do.
And I love the ability to be able to be there for these patients in probably some of the most anxious and scary times in their lives. It takes a lot of communication to be able to, in 5 minutes, talk with these patients and get them to trust you and realize that you're there to help them out.
I get to take somebody's day that is full of fear and anxiety, and I get to take that all away.
Probably one of the greatest challenges is just going through the schooling process. It's very rigorous and very demanding and takes a lot of time and effort. And if you don't have drive and work ethic, it's going to be very difficult.
On some days, you have to be able to cope with a really sick child or a person that dies on you in the operating room. On some days, you have to be interrupted at home. Sometimes your family life gets disrupted. But all in all, those are just kind of things that you just sign up for. My profession requires a variety of skills. You need to have good people skills. You have to be able to deal with patients. You have to know how to deal with operating room staff and surgeons. You have to be able to think clearly on your feet. There are so many complex things that we do, and you have to be able to handle pressure.
I think the moments that remind me the most why I'm in this profession is when I wake my patient up and they ask whether or not we're going to get started on the surgery. As well, my preoperative assessment of the patient. That's really my time to be able to connect with the patient. And a lot of times my ability to pray with my patients and ensure that they know that it's not just me taking care of them, it's God too.